Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching. Have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Lance Whitney. He is the Director of Public Policy and Advocacy for the Arkansas Hunger Relief Alliance. Lance, thanks so much for being here.
It is my pleasure, Robin. I appreciate the invitation.
So to start, can you briefly describe the mission of the Arkansas Hunger Alliance and the populations that you serve across the state?
Absolutely. The Arkansas Hunger Relief Alliance is a collaboration as a statewide voice to advance solutions to hunger. And then our vision is always to create a hunger-free Arkansas. Mm-hmm. And we do cover the entire state of Arkansas, every county, and we are the alliance of the six Feeding America food banks that cover the entire state of Arkansas. They are on our board, and we work closely with them and do directives with each other.
And when we talk about food insecurity in Arkansas, what does that look like today, and how does it vary between rural and urban communities?
The latest report from USDA that just got released December 31st, it was supposed to come out in October, but got released with everything else on the 31st, ranks Arkansas as number one in the nation in food insecurity at 19.4%. This isn't our first time to be number one. The last time the report came out, we were number one as well. And as far as the rural and the urban communities, Arkansas is a low-income, low-accessibility to food state in general. Of course, there are food deserts throughout the state of Arkansas, in every region of Arkansas, but the definition of a food desert, which deals with the accessibility to food and nutrition, is 1 mile in an urban area, accessibility to that resource of food within 1 mile in an urban, and then 10 miles in a rural area. Our food deserts in Arkansas definitely exist. They are challenged with many policies that are going on currently and changed policies, but are existing for the Grocery Retailer Association, and the accessibility to food is always a challenge for many areas in Arkansas statewide.
And from your perspective, how does food insecurity function as a social determinant of health, like particularly for chronic disease like outcomes like diabetes, hypertension, and even maternal and child health?
Well, it's not a strange fact to understand that food insecurity limits people's ability to have a balanced diet, and a balanced diet is directly related to their health. We have a saying here at the Alliance that's done with everyone who works in this industry: is food is medicine. And so many Americans just don't make enough money to purchase the most nutritious items like vegetables and fruits or proteins that are recommended by the dietary guidelines put out in America. So the high calorie and the ultra processed foods are often inexpensive and more available, and then the resources can go farther for those households. And often the only available choice in food deserts or food swamps are unhealthy foods or resources or retailers that don't carry the most nutritious foods. The only way to improve the health outcomes for these low-income families across the state of Arkansas and in these food deserts is to have reliable access to nutritious food.
So Arkansas, as you mentioned, ranks consistently high for both food insecurity and poor health outcomes. What structural or systemic factors contribute to this overlap?
Again, it's the lack of access to nutritious foods and affordable foods. We mentioned many hurdles with medical services, Medicaid, also healthcare deserts, which are, typically right along line and carry along the same area as the food deserts. And it's not a hard dot to connect with each other. A good place to work in food system talking points like Arkansas is as being an agricultural state And yet, why do we have such food insecurity? So the systematic factors that contribute and overlap are availability to access this food, and then the outcomes that it causes, the burden it places on the medical facility as well. So the overlap is just simply food is medicine. The same thing that leads to these chronic diseases oftentimes start with the poor nutrition or poor access to food.
And how are healthcare providers and systems in Arkansas already seeing the downstream effects of food insecurity in clinical settings?
Well, Arkansas being ranked number one in the country for food insecurity, it's not surprising that we're also one of the states with the highest, and almost 40% of our adults are considered obese. Food insecurity amongst adults, they spend an average of nearly 20% more on health care. A lot of that is directly related to what they've access to nutrition. And then their food secure peers that don't have that expense or as high as expense. As long as healthcare costs continually goes up and the strain on the household budgets continue to be a strong cycle or a strong factor for poor nutrition or disease, then the food insecurity and the diets are definitely disease related and will once again be prevalent in the state of Arkansas.
Mm-hmm. And what role can healthcare organizations play in identifying food insecurity? And what's best practices are you seeing around screening and referrals?
Many healthcare providers are incorporating food security screeners as part of their standard practice when they do intake. We think this is important on a couple of reasons. First, they trust that person that they're going to for their health care, and it's a one-stop shop to get that information, a healthcare provider, and then have access to patients with food security can help overcome the stigma. They're in a situation where they're asking for help. If they have that one stop, they can also find out how they rank upon food insecurity within their household. It helps both the medical profession and those that are trying to do best in policy to better understand what's causing these poor nutrition and these poor health issues. To tailor clinical care to patients underlying the needs, nutrition is a preventive measure. And as we use that as medicine, which food is medicine, I'll say again, instead of the ongoing battle of managing diet-related conditions, we need to understand that everything that we can do with nutrition is directly related to where they're going to end up having access to better health care and also have better access to future better health. To potentially reduce healthcare costs by reducing emergency room visits and reducing the obesity and the chronic illnesses that happen in the state of Arkansas with patients, each one of these medical facilities, once they better understand the household, then they can better understand the patient and the needs that would help them get into a better place health-wise.
And are there tools and models that you recommend providers use?
It isn't a specific screener that we recommend in that tool, but we are concerned with what a provider can provide with information once a family is known to be food insecure. We want every clinic in Arkansas to be confident in talking about the importance of nutrition, the safety net programs that are supportive of nutrition, understanding SNAP and WIC, school meals, summer EBT, other programs like that. And the Alliance here, we provide education and support for these referrals to the medical facilities to let them know best ways to get that information to this one stop when they do the intake, and allows these families to understand that the stigma doesn't have to exist and it can be handled in a systematic way that is friendly and accessible to them.
And beyond access to food, how does nutrition quality factor into health outcomes, and what barriers prevent families from accessing healthy options? You touched on this a little bit.
Yeah, and you're going to hear me repeat probably a couple of things every once in a while. But, food security versus nutritional security, that's two different animals to say. access to just having food is one thing, but having access to nutritional food is the definition that the medical field is best at understanding. We believe that everyone deserves to have access to nutritious and safe and delicious food, food that they want to eat. But the loss of a SNAP education in the last bill that came through from the federal late in July, it took away this SNAP education, which allowed people to better understand how they can cook more nutritious meals, how they can read what's in something they're purchasing, and how that's going to directly affect their health from what their health official has told them they need to watch or do. This is an education that we feel is important to not only understand what your body needs, but to better understand what you're purchasing and how that is going to happen. And better understand, just because it comes in a can doesn't make it nutritious. Just because it says it is a certain item, it may have the lovely form of saying it's a healthy option, but it doesn't mean it's the best health for what their regulation is. Mm-hmm. So SNAP education not only teaches them how to read labels, but also how to take items and how to properly cook it within their home so that they can make better choices and hopefully more affordable choices in that process. So I definitely believe that SNAP education is so very, very important. And it's a program that's now been eliminated, and it needs to still be in the communities. And the Alliance does do a SNAP education program where we try to help people better understand if these are what you're getting from food banks, and if this is what you have in your cabinet, or if this is what you have access to monetarily, then this is how you can prepare it that's best for your household, for their health, and for their budget.
And what successful partnerships have you seen between healthcare organizations, community groups, anti-hunger initiatives that are making a real effort?
Yeah, thank you for asking this question, because our partnerships are very, very key in our success and fighting food insecurity in Arkansas. One great example of a multi-sector partnership is we do our produce prescription partnership, and we lead the Arkansas Fruit and Vegetable Prescription Project with the Baptist Health Community Outreach. And that's where patients with diet-related conditions receive a $50 a month in fresh fruits and vegetables and monthly health screenings along with those. And that allows us to understand the correlation between fresh fruits and vegetables, how it relates to their checkups, and watch them see success in these reports, because we know people go to these doctors' visits and a little bit fearful of what they've done until the next stop. But food insecurity, nutritious food, increase the health possibilities to have a successful visit, and so it decreases healthcare costs in the long run.
And what policy level changes, state or federal, could make the biggest difference in improving nutrition security and health equity in Arkansas?
Well, I'm going to be a little biased here, but I promise you that it's good fact, and it's good news for both physician to understand, and any healthcare official, is that the voice of the medical community and being able to help with state and federal policies is significant in success, both for the legislators to best understand, for the physicians to get results, and for policies to be directly related to those that are in need, so Arkansas will be in a better place. Keeping SNAP and federal nutrition programs, it's just a priority. It has to be. And at the state level, when fiscal responsibilities are being shifted to the state now from the latest policy from the federal level, what was a shared responsibility or a total federal responsibility now is being placed on the state to increase their budget needs. So we have to keep these SNAP programs. We've got to keep these WIC programs, because the expense it costs far, far exceeds the devastation that would happen if this did not exist. And the healthcare industry will be hit harder, the grocery retailers, the community sustainability will be hit hard. And Medicaid 1115 demonstrates waivers that other states have worked in produce prescription and food as medicine interventions. These are such significant programs to better understand food insecurity, but also how it benefits each community, both in the retail section and the healthcare and the education, but also in just the household health well-being.
Well, Lance, thank you so much for sharing this important information, for educating us about what we can do, what anyone can do to really help educate and teach others about what food is medicine is.
Well, I appreciate the opportunity. And first and foremost, this is a great time right now to talk about this topic because it's so prevalent. A lot of people say, oh, there's so much of this going on, but it's brought this as number one in the nation in food insecurity in Arkansas to the table to discuss. And whether that's a bad thing, which we don't want to be in, but it shows it's a topic and it needs to be talked about. And we need to take advantage of that and let our voices be heard so we can better understand. And let's go from being the top in food insecurity to the top in how we can adjust that needle to be in a better place for the state of Arkansas.
Lance, thank you so much. Thanks for sharing this important information, and thank you for being here today.
My pleasure. Thank you, Robin.
And that's it for this episode of AFMC TV. Thanks for watching, and have a great day.